So thank you all for tuning in. Today I have Amy Baumann with me. She is a professional dog trainer and pet parent of Poison Ivy, who is an almost 4-year-old Briard. And I wanted to take this opportunity to have Amy tell us from her point of view as a pet parent, kind of her journey with Poison Ivy and getting the diagnosis of hip dysplasia and kind of the journey you two have been on. Yep. So thank you for joining us today.
Absolutely.
So what were some of the symptoms that you first noticed that made you think that something was off with her?
So I've kind of had a feeling that something wasn't quite right with her within the first couple of months of having her. I figured that something was a little off when she was probably about 4 months old. A little bit more lethargic than a normal puppy. She wasn't bouncing off the walls like a normal puppy would do. And I spoke to her breeder, who's a wonderful woman, has got no history of hip dysplasia or anything like this in her lineage. And she said, oh, you know, it's a calm breed. Okay. And so we kept an eye on it for a long time, and she got better. And then about 1.5 years old, she started to slow down a good bit as well. So I chalked it up to her just being a relatively calm dog, didn't really care to do that much. I always knew these were relatively relaxed dogs when they were at home. I didn't start to think that there was something really, really wrong until probably June of 2023, I want to say. We went to a barn hunt competition. At this point, she was already competing at a master level, and she just refused to do the tunnels, which for a dog her size obviously is pretty challenging to have to do an 18-inch tunnel as it is, but for her to consistently go part way in, wince a little, and then back out. It was actually Paula, the owner of Canine Country Academy, that said, you know, something looks a little odd, you should get that looked at. And then that's when we went to our first vet appointment.
Okay. And then at the vet appointment, what did they do in terms of the exam? Did they go right to x-rays, or did they just kind of look her over and do a physical exam?
So I started with my regular vet, who was the one that I spoke to when she was a puppy, saying, you know, this seems like lethargy, this is really abnormal. And my vet has always been fantastic, but he was a little dismissive about it, saying, oh, you know, she's always been calm, I'm pretty sure she's fine. So I ended up going to a reproductive specialist in Alpharetta that was used to doing OFA testing with breeding dogs. And he ended up actually telling me the same thing. He said, oh, she looks fantastic, her hips are going to be great, her elbows are going to be great. He even went as far as saying, here, I'm going to give you some anti-inflammatories so that you could see for yourself that she's fine and it won't make a difference at all. And then not only did she fail her hips for her OFA, it ended up increasing from what would be considered mild on one side to moderate on both sides in a little less than a year.
Wow.
Yeah, so she progressed very, very quickly. She developed arthritis very quickly, and at this point she wasn't even 3 years old.
Okay. So how old was she when she had the first x-rays done then?
First x-rays got done a little bit after 2 years old.
Okay. And at that time it was considered mild on one side?
Yep, at that point her left side was considered mild and her right side looked pretty good.
Okay.
And there was no sign of any arthritic development, there was no sign of any issue with her lower back. They said that a dog showing the x-rays that she had, she should be relatively asymptomatic.
But you were seeing a difference?
I was. She was so clearly, now that I knew what signs to look for, she was so clearly uncomfortable. You could tell, you know, oh, she doesn't want to get up and down from the couch, she likes the floor. No, getting up and down on the couch was uncomfortable for her. This was the same time that she started to develop some behavioral concerns that seemed very out of the norm for her as well. The fact that she's always been fantastic for grooming but never wanted to be standing more than for a couple minutes at a time. All these things that I always thought was just a lazy dog was actually a lot of chronic discomfort.
Okay. So you started her on an anti-inflammatory,
Yep.
and you did start to see change pretty
Yep.
much right away?
Yep, I noticed within probably 24 hours of being on the anti-inflammatories that she was bouncing off the walls and she was jumping like crazy. She was a mad woman, basically. So she went from her usual, meh, I don't want to do anything, to completely insane. And that's when obviously you and I got in touch and we started doing physical therapy so that we can consider getting her off of the anti-inflammatories, which took probably about a year or so before we were able to find something that worked for her. At that point, she was already developing so much arthritic growth that we ended up starting her on the Adequan injections as well.
And for those of you who don't know, Adequan is a natural substance that our body produces to help with joint fluid and can act as an anti-inflammatory but a more natural substance. One of my concerns was with poison ivy being so young, we didn't want to have her on prescription medication more than we needed to. So I was helping Amy to work with her vet to try to find kind of some more supplementation and some more natural options to manage her day-to-day pain. Yep. And then save, you know, the anti-inflammatories for any flare-ups that she had.
Yep.
And then we also started working together on a strengthening program for her. So when I first met Ivy, I noticed that she tended to stand with kind of a sway back. She didn't have a very nice straight top line. Yep. So in this breed, they should have a very flat spine when they stand. And she tended to be a little bit sway backed. She also tended to walk with her hind feet pretty close together. Yep. And a lot of times when she would stand, and you look at her from the top, she would tend to cock her hips one way or the other. Yep. So we started working on getting her more comfortable, improving her range of motion in her hips, and then starting to work on muscle strength. Because she did have quite a bit of muscle loss too in her hind end when I first met her.
She did. I would have never noticed if you hadn't said anything because of all the hair.
Yeah, with all the hair, you really have to get in there and palpate and really feel, you know. So what was it like in terms of doing the exercises and getting her on the supplements? Did she take her supplements pretty well, or was she...
She's historically never been good about taking medication. I am extremely grateful that we spent a lot of time conditioning, you know, the Kong brand squeezable tubes that you can get for the peanut butter to fill the Kong. I could just pop a pill on top of it and squirt some peanut butter in her mouth and she'll take it no problem. But if you try to hide it in something, she'll get very suspicious. As far as any type of pill, pop it on the cheese sprayer and she's pretty much fantastic. She actually took to the Adequan a lot better than I expected because she's always been so terrified about going to the vet. But we spent a good bit of time working with Paula. We did a lot of cooperative care conditioning, so she actually gets kind of excited when she sees the needle every month now, because she's going to get string cheese. Yeah. So she actually enjoys it, and any of the physical therapy exercises that she's done, she thinks it's a fun game. She has a great time with it. You can see that she's a lot more confident in how she's holding herself now. Mm-hmm. She's not as, you know, there's not as much trepidation when she steps somewhere. You can tell she's got a lot more confidence in where those back feet are too, and she's not tripping over herself.
Good. And then I know we also had discussed using the hip line garment as part of her treatment program, and you decided to go ahead and get one of those that you could use at home. So did she take to the garment pretty well?
Surprisingly better than I expected. We had talked about it when you had told me that it was something to consider for her, that she absolutely despises wearing clothing. She never makes anything quite easy. Yeah. Can't stand wearing a jacket, can't stand anything other than really a hair tie essentially. But the very first time we put that garment on, she was a little confused why it was so snug. And then 5 minutes later, she was completely fine. We use it now when there are thunderstorms, so we could use it instead of a thunder shirt now. Okay. She's so much more relaxed when she's wearing it. It doesn't bother her. She doesn't run from me when it comes out. She actually really likes it.
Well, good.
Yeah, I've been very surprised about that.
And then you started using it mostly like on your walks at home?
Yep.
Did you use it during your exercises or more when you just went out for walks?
We did a little bit of both. Okay. We do a little bit of both, kind of depending on really how much I remember too. So I've gotten a lot better about putting it where I can see it. And you're done. So we've gotten a lot better about making sure that we're using it on walks now that the weather's cooling down. I don't worry about her overheating while she's wearing it. She wears it around the house, just kind of moving around sometimes, but we do make it a point to put it on whenever we do her physical therapy as well.
Mm-hmm. Well, good. And so it's been probably about a year or so since we've met and started working together.
Probably about a year and a half now.
Yeah, how time flies.
I know, it's crazy.
And so what are you noticing now compared to in the beginning, kind of like over this last year, year and a half? What has your journey been with her?
Honestly, it's been a lot more positive than I expected. I was telling you when I first met you that when I was trying to figure out what was wrong, why I would be seeing chronic discomfort on, at the time, a 4-month-old puppy, and all the way up until 2 years old, she hit a year old and she tanked. We were talking about pulling her from dog sports, we were talking about retiring her early, we were having quality of life conversations at not even 2 years old at the time. So I came to you and I told you that essentially hip dysplasia was worst case scenario for me. And now she's on no pain management, she's on no anti-inflammatories, she takes her Adequan shot once a month, and she's completely insane. We're doing more dog sports than we ever did before. Now I know what I can push her in and what we can't. It makes so much more sense, the things that she did struggle with when she was a lot younger, of what doesn't bother her now. You know, when she was a puppy, she couldn't stand correctly in the show ring, coming to realize that wasn't poor training, that was her back. Now she can stand beautifully. I don't care to put her back in the show ring, but I think she could do it now. She enjoys doing a lot more high impact things than she really should be doing, but now she doesn't think she's breakable, so she's actually kind of nuts. But that's not a life I ever thought she was going to get to have, so I couldn't be happier with where she is right now.
And she's back doing barn hunt.
Absolutely. She's back doing barn hunt. She got her Master A title 2 or 3 months ago. She's only the 3rd Briard to ever get it.
Oh, congratulations.
She's doing fantastic in the barn. She's throwing herself off 8-foot-tall bales of hay, and she's not paying for it the next day. When she does randomly decide to be Evel Knievel, I don't have to come and see you the very next day anymore.
Yeah.
She's able to recover from it better. I know what to do when she does have a harder time. I don't think that she's going to slow down anytime soon now.
Well, that's wonderful.
That makes me feel so much better. I was so worried about her.
I know. At one point you were talking about just, you know, not being able to really do much other than have her be just a family pet and go on walks, and that was about it.
And that's not the life that I wanted for either of us.
Right.
You know, I got her to live an active life, and I had aspirations for her, and to see her so clearly want to do them and just not be able to was so heartbreaking. And now I can't stop her from doing it.
Yeah, and really this breed they're a herding breed,
They are.
Aren't they?
Yep.
Yeah. So I mean, they're bred to be active and to move all the time.
Yep,
And
they're bred to work, they're bred to think, they're amazing couch potatoes, but they don't want to be couch potatoes all the time.
right.
You know, before she was perfectly happy to do this for weeks at a time before she would get antsy. I can't go more than a couple of days of sitting around on the TV before she starts to get annoying now, and that's how they're supposed to be.
Yeah.
And it makes me so happy to see her get to live the life that a Briard should get to live.
Yeah. That's wonderful.
Absolutely.
And I know you made a few other environmental changes too, so that like getting in and out of the car, you have a step plate so that she can step up and then step down so that she doesn't have to jump in and out.
Yep. And depending on the day, she will push past the step and she will now jump into the car. If she's excited enough, she will throw herself into the car. She's not allowed to come down anymore out of the car like that. The only time that I will let her jump into the car is those rare occasions that she is so incredibly excited, so I can remind her that you can actually do this. But most of the time we either use the step where I will physically lift her up into the car, or she'll do a little trust fall to get out of the car. So when we're not in my car, she knows she can't jump in and out anymore. Yeah, so we've made those adjustments. We make it a point to be a lot better about certain behaviors that she was learning how to do, certain behaviors that she was practicing that aren't so good on her hips and her back. We've discontinued certain tricks. We've stopped expecting her to go up and down stairs at a particular speed. So we've tried to make a lot of changes to make things as easy for her as possible. We've added more orthopedic beds into the house. We've gotten a sissy loop as well, just for those more achy days.
Well, that's great. And as a dog trainer, I know you had kind of a little bit of extra, what do I want to say, like behind the scenes knowledge of, you know, teaching her some of this cooperative care and stuff. But what advice would you give other pet parents for maybe just some daily lifestyle tricks or guidance for them just in case they are dealing with a pet that has some medical issues, to make it easier for them to care for their pet and also for healthcare professionals such as us
Absolutely.
to care for our pet.
Absolutely. I have always been a big advocate, especially owning a breed that is so incredibly high maintenance as far as grooming goes, has been teach your dog to tolerate or enjoy husbandry type behaviors. It shouldn't be a fight to cut their nails. It shouldn't be a fight to brush them. So teach them from a very young age or as quickly as you can into having them. Those aren't scary. As you already know, obviously, having things like even just overgrown nails makes a huge difference in how their orthopedic health is.
Right.
So making sure that your dog is comfortable having their body handled, making sure they're being confident about having medical professionals touch them. We talked a lot about how proud I am that she's okay with you touching her,
Right.
in spite of her dislike for the process. Making sure that you do just even basic puppy push-ups, but something that you taught me that in 15 years training I never considered, making sure they have correct posture. So even just having somebody look at them from an orthopedic standpoint as a preemptive thing can be huge.
Yeah, just to know, just to understand what is normal and what's not.
Absolutely.
Yeah.
And a lot of people don't know, especially when they're not animal professionals. You get a puppy and you don't know sometimes what's normal and what's not, what's lethargy and what's a calm puppy.
Yeah.
So getting outside perspective helps a lot.
Yeah, and it gets very confusing as puppies because a lot of puppies are gangly and they're
Yes.
not coordinated and they do move funny. So what's a normal abnormality versus a pathological abnormality or a
Exactly.
problem that's doing? So that can be even tough for us
Yeah,
sometimes in young dogs like that.
absolutely.
But we rely a lot on you too because you know your pet better than anybody else. So
Exactly.
like you said, even you chalked it up to, okay, maybe she's just a calm puppy, but you did have that gut feeling that
Exactly.
there was more to it than that.
Yeah, listen to your gut has been a big thing for me that I've learned with her. She is from, like I was telling you, she's from wonderful lineage for this breed, and I have an amazing relationship with the woman that she's come from. She's held my hand through all of this. She's been extremely helpful, but it's so hard to believe your gut when the vet and your friends and your partner and the person you got the dog from at the time was even saying, I think she's okay. I think she's okay. Because you don't know sometimes. But if you've got that gut feeling, the worst thing is you try and find out that you're wrong.
Yeah.
So
I think that's sound advice, like go at least, but it's also hard that you did have to advocate for
Absolutely.
her because you got told even by professionals
yes.
early on that she's fine, just give it some time, but you just really felt like she didn't have that much time and that you needed some answers.
Absolutely.
So good on you to keep pushing for answers so that you could get on a management program with her.
Absolutely. I mean, she has seen so many veterinarians and she's seen so many professionals now. I think I had told you before that we had to take her to UGA for a neurology consultation because at one point we were going down the avenue of, everyone says that her hips can't possibly be bad enough to cause all these things. Maybe she has a lower back problem. And I really had to push my vet to give me that referral to go to a neurologist. And I'm really glad that I did because they were able to tell us what you and I were correct about and what we weren't correct about. And had I not known, I wouldn't be able to know if I had to make some of these adjustments for her.
Right, and me as a professional, am I giving you the right advice and are we doing the right exercises for her and the right treatments? Because hip dysplasia can very much look like low back problems, like lumbosacral disease and other other problems in the low back because it's such an interconnected area, but the treatments for some problems are different than they would be for the hip dysplasia.
Exactly.
So it is always good to make sure that you get the x-rays or the MRI or the consults with the specialist so that we have an accurate diagnosis and we're actually treating the right thing, not just assuming based on the symptoms that one problem's going on and possibly there's something else
Absolutely.
different going on. So what would be your tips or kind of your wisdom to other pet parents who may be in a similar situation where either they have that gut instinct that maybe something's not right with their dog, or maybe they're seeing some of these same signs that you were seeing? What would you suggest to them kind of next steps to be?
I mean, definitely trust your gut if you think something is wrong. You know, talk to the support group that you have around you, whether it be the rescue organization that you may have gotten your dog from, or the breeder that the dog may be from. You know, reach out to the people that can help you, but definitely mention it to your vet. I have seen over the course of my career so many issues that dogs have as puppies or adults that we all assume are behavioral, but really it can be medical. You know, something like if you start seeing that lethargy, or you know, that little booty sway in your golden retriever is a little bit more than you think, it's worth it to get the x-ray. It's worth it to, dare I say it, spend a little bit too much money at the vet to find out that you're wrong and everything is okay, then go years and let things continue to get worse, you know? Yeah. I ask myself a lot, with the level of arthritic development she has at such a young age, had I found out what was wrong sooner, had I gotten her on physical therapy regimen, had I gotten her on these things that we're doing sooner, could I have avoided the arthritis to the extent that it is so early in life, you know? Could I have had more time had I just trusted my gut sooner, you know? So get the x-rays even if you don't think you need them. Get the second opinion if you don't think your vet is listening. Reach out to people that will listen to you if you don't think that that's happening where you're at.
Yeah, I think that's good advice. And I would also say, when you were kind of talking about the behaviors, for her it was more the lethargy, but I've also seen it on the opposite side, where they may get nippy with family members, or they may get very sensitive to being touched, or they may put themselves away in another room and not kind of hang out with the family. So any sort of behavior changes, and you probably see this as a dog trainer, with people coming of things that they think are behavior problems, that now you have that background that you think, you know, this may actually be physical, let's get this checked out before we treat it as just a behavioral problem.
Absolutely. And I don't personally think it's a coincidence for her that the absolute lowest that I think she was in terms of her ability to move and how she was physically feeling, I don't think it was a coincidence that that was the same time that her ability to handle stressful environments or being around dogs that she doesn't know, that was when she was her absolute worst. That was when she seemingly overnight developed aggression towards dogs that she didn't know. All of these behaviors have pretty much entirely gone away now that she's not in pain.
It's interesting to be able to correlate that. And it makes sense. I mean, when I don't feel good, it's like, just put me in a room and just, I'll call you if I need you, because otherwise I don't want to play nice. I don't want to talk to anybody.
Absolutely. Yeah. You know, and in her case, doing the things that she loves, which if I tell her, do you want to go find an RAT? If she doesn't lose her ever-loving mind when I say that word, she's not feeling good.
Yeah. And
we were to that point where we could be actively at a barn hunt trial, and she just didn't care. She didn't want to do it. And you know that's not my dog.
Right.
So if you get that feeling of that's not my dog, that's usually a good follow your gut. Always follow your gut. You know your dog better than anybody.
Yeah.
It's best to just listen to it. Worst case scenario, you find out you're wrong and it's nothing.
Right.
But I think that's so much less damaging than waiting.
Yeah, absolutely. Because the earlier you can catch things, the more treatment options there are.
Absolutely.
Like you said, if the arthritis hasn't yet set in, then we can help slow down or maybe prevent some of those arthritic changes from happening.
Absolutely. Absolutely.
Well, thank you so much, Amy.
Of course.
It was great speaking with you, and thank you for your time today.
Absolutely. Happy to do it. She didn't mind it at all.